We have done promontory drilling for a number of years. We looked at our results in cases that need promontory drilling. Now, first of all, who needs it? A patient with a narrow oval window niche needs the promontory drilled. The niche may be narrowed because of an overhanging facial nerve. It may be narrowed because of a very large promontory or a combination thereof, or an extremely long incus. So the question is, if you drill in the promontory, do you cause nerve damage? Well, we took 25 patients on whom we had done promontory drilling, and then we took a whole series of patients who didn't have promontory drilling selected at random, and we age matched them, and we matched their amount of hearing loss, and both by air and by bone. We found then, when we measured the results, there was no difference in the air-bone gap. There was no difference in the postoperative bone conduction, except a little bit of loss, surprisingly, at 2,000, about 4 decibels. Otherwise, the adults were identical, but we were able to accomplish the surgery. So we're not afraid to drill, to do our promontory drilling. What we do is we place the Skeeter drill on the footplate, and then we pull up, put it back on the footplate, pull up, back on the footplate, and pull up. The diagrams that you will see first the diagram that shows the problem. The promontory is in the way. You'll next see the action of the drill in the next picture as we sweep up each time, and use the posterior part of the promontory to do that, not the anterior part. The posterior part, you're going to stay away from danger, and you're going to stay away from bleeding. The third picture will show the prosthesis in place, and you'll see how beautifully it is in place, avoiding now the promontory that was there, because the promontory is no longer there, causing a problem. So you may drill in the promontory. You will not cause further sensory neural loss. You will have a nice field in which to put your prosthesis.